New York Governor Andrew Cuomo says that a COVID-19 related syndrome has killed 3 young children in New York City. Over 500 children have been sickened by PIMS worldwide, an alarming rise in a phenomenon that was first publicly identified in April. Many of the symptoms bear some resemblance to a rare childhood illness called Kawasaki disease. PIMS is a toxic shock-like inflammation that affects the skin, eyes, blood vessels, and heart, and can leave children seriously ill, with some requiring artificial ventilation. Dr. Barbara Farrer is with the LA County Health Department.
We are today beginning a survey at all of our pediatric intensive care units to make sure that they haven't identified a similar syndrome.
Over 1,800 pediatric specialists took part in an emergency video call to discuss PIMS. New York City health authorities officially issued a warning about the potentially deadly condition early last week. New York City hospitals have over 20 children with symptoms of the illness. Most of the children also tested positive for COVID-19 or its antibodies. In California, 4 children have been identified with PIMS. 3 are currently being treated at Children's Hospital Los Angeles. All have tested positive for COVID-19 or its antibodies. Dr. Jeffrey Galpin is an infectious disease specialist who is urging caution with a newly identified illness.
So none of this is unique, but we need to understand it uniquely within this particular disease, and it is certainly worrisome. Some people may be partly immunized, some may have mild disease and get a certain amount of immunity, but not enough. But maybe enough to make the immune system primed so that the next time they're exposed, they may even get a more severe disease.
Doctors say the new inflammation cases differ from the Kawasaki virus in that the new syndrome has impacted children between the ages of 5 to 10 rather than under 5. The National Institute of Allergy and Infectious Diseases announced a $25 million 6-month study on COVID-19 in 2,000 U.S. families that will include questionnaires about social distancing practices, symptoms, and biweekly swabs for active infection. The CDC separately is financing the creation of a registry that will track COVID-19 cases among children at more than 35 children's hospitals to understand why some young patients get very ill while most do not. In Los Angeles, I'm Alex Cain, Pacifica Radio, KPFK.